We are back again, and my name is Sherry Creso, and I am the host of your show tonight. And I didn't know when I announced the topic just how relevant and how needed and how wanted this topic actually was, because the outpouring when I said we were going to talk about ear infections and antibiotics, holy cow, everybody went crazy like, oh my God, perfect timing. This is exactly what I needed. How did you know? Thank you for doing the show. And so obviously it is an issue that so many of you are facing, so many of you are dealing with your children, your babies, and then, how to deal with it. How much medication are you using? What are some alternatives? What are things that we need to look at when it comes to this very common childhood illness and how to deal with it the right way. So I'm really glad that we're actually doing the show tonight, and we have our very favorite pediatrician and special guest, Dr. Susan, with us. So I'm going to bring Dr. Susan on. We're very excited to have her back. Hi, Dr. Susan.
Hi, everybody. Thanks for coming.
We missed you. We missed you.
Anytime, Sherry.
I know. I called you up. I'm like, can you make it? You're like, yeah. I'm like, yay! Everybody's gonna be so happy, and that was exactly what happened. The questions started coming in, and they were like, we love Dr. Susan.
Yeah.
So they just wait for your episodes to come back, and it's like, we could just pick any chapter in Dr. Susan's book, and every single chapter is just so relevant and so important, and I think that's what we've been doing over the past year and a half, just picking a chapter and going for it, and it's great. Fantastic. For any of you who don't know Dr. Susan Markel, she's an amazing pediatrician. She's a speaker, and she's an author of a book called What Your Pediatrician Doesn't Know Can Hurt Your Child. And if you have not read this book, you definitely want to get yourself a copy. It's an awesome book. It's an awesome book. Thank you so much for writing that fantastic book for so many people. It's just,
you're welcome. It's a labor of love, as they say.
I know it is. I know it is. You can read it in every chapter how much it is an expression of you and your feelings about children and supporting parents, because it's just so obvious in every word that you've written. So I want to thank you personally for that.
Thank you.
Mm-hmm. Let's start by talking about the whole concept of ear infections in general. I mean, it's a pretty common issue for babies and children, right, Dr. Susan?
They say that 30% of visits to the pediatrician involve ear infections.
Right. So it is something that, a lot of children are going to encounter. It's what we see, as a pediatrician, I'm sure you see a lot of people coming in with their babies with ear pain and issues relating to ear pain.
Yes.
Yeah. So now, what are some of the causes, if you were to talk about, like, what are some of the causes that can cause an ear infection or an issue where they're having that kind of ear pain?
In a young child, there are anatomical differences than there are as children get older, and the main issue is that the eustachian tube, which is the tube that goes from the middle ear to the back of the throat and therefore drains any fluid. In a young child, that eustachian tube is not vertical.
Yes.
When it's vertical, as they get older, then the drainage is simple. It's gravity. But in a young child, that tube is more horizontal, and therefore any fluid that accumulates in the middle ear or in the eustachian tube itself is less likely to drain to the back of the throat and the nose.
Gotcha. And so is there a certain age, I think it was like age 3, where that starts to straighten out?
Well, it's gradual, and I don't know that there's a particular age, but I would say that probably after the age of 12 months,
okay,
it'll start to change significantly. And we don't, although ear infections are totally overdiagnosed, and we're going to talk about that tonight.
Yes.
But even given that, we really don't see ear infections very much once a child is, let's say, kindergarten age. It completely drops off because of that anatomical change.
Right. So the tube, the eustachian tube starts to straighten out, and so the drainage is better, and that's why you don't see it in a child that's a little bit older.
Right, and certainly adults, rarely get ear infections.
Right.
So,
That's true.
That's even.
Right. So let's talk about this overdiagnosis. What exactly is happening?
Well, what's happening is that I guess, maybe we can use the car analogy. When you take your car to the mechanic, you really have no idea what's going on with the car, just that some light came on in your dashboard.
Yes.
And you really have to trust the mechanic to tell you exactly what's going on.
Yes.
And the mechanic could just say, well, it's just a malfunction on the light that went on. I'm going to turn the light off. Or the mechanic can say that you need to have an entire engine overhaul, and basically you wouldn't know the difference. I know I wouldn't. I mean, maybe some people in the audience and I would, but the point being that when you take the child to the pediatrician about an ear, you're at the mercy of the pediatrician because you really can't see or know or understand what's going on.
Yes.
And I think because of that reason, ear infections tend to be overdiagnosed. That is, a child is given the diagnosis of ear infection, or as we say, acute otitis media, when none really exists.
Right. Okay, so what would be some of the things that somebody would see in a child that would make them think that there would be an ear infection? Pain, fever, like what are some of the signs?
If a child really is in pain and really has a fever, then that is probably, that is more likely that a child does have a true ear infection. The problem is that many times children are not really in pain, or they don't have a fever, but a doctor will take a look, and the path of least resistance in a crying child that the parents have brought into the doctor because the child isn't sleeping or has a cold. The path of least resistance is often to say, the eardrum looks a little pink, and I actually use that phrase in my book because it's so common and it's so meaningless.
Yes.
For the doctor to say the eardrum looks a little pink, I think we ought to treat for an ear infection, and there you go on 10 days of amoxicillin, which is totally uncalled for and useless, and maybe even to a certain extent harmful to the child and to society as a whole.
Right, right. So the overdiagnosis is really coming from just, treating every time they look in an ear, if it looks a little pink, if it looks a little red, immediately diagnosing an infection that would require some kind of treatment and medication.
Right, and the reason that happens is that, first of all, yes, an eardrum looks pink. And it really, the natural color of the eardrum is more of a grayish color. But if a child is crying, just crying alone, the eardrum will be pink, or even over and become what we call a red eardrum, because it's just from the crying. You can almost imagine the child's face is red and the eardrums look red.
Yes.
So you're going to have a pink or red eardrum just by virtue of the child crying. So a diagnosis of an ear infection with a crying child, which is often the case, that if the child is crying, is basically useless.
Yes.
And so it's not accurate to say that because the child's eardrum is off color, that the child has an ear infection.
Yes. And also the fact that a lot of the times the infections that they do have come from like an upper respiratory infection, which could be viral, which the antibiotics or that type of treatment's not going to work for anyway, correct?
That's right. Most of the time, ear infections are caused by having a viral upper respiratory infection. It's part of having a virus. It's just the same way as saying a child who has a viral upper respiratory infection will have a runny nose.
Yes.
A child with a viral upper respiratory infection will have a little fluid in the ear, and the eardrum will look a little pink, as they say again. But that is not a cause for putting a child on an antibiotic. It doesn't work for that, and it has no value.
And it actually can be harmful because the antibiotic can actually have a negative effect on the viral infection, correct?
Well, the antibiotic has first of all has side effects in general. Children often don't tolerate antibiotics because it's either allergies or because it causes gastrointestinal upset, because it changes the natural bacterial flora in the intestines. Because don't forget, an antibiotic doesn't know, so to speak, what it's there to kill. It kills everything, and it kills all the good flora in the intestines, so the child will have gastrointestinal problems.
Yeah.
Um, Also, by using the antibiotic, you're killing off bacteria that are destined to be killed by that antibiotic. But what does that leave? It leaves resistant bacteria. There are certain bacteria that will not be killed by the antibiotic, and therefore the next time around, which would
Yeah.
be maybe a week later or 10 days or a month later,
Yeah.
the child's going to have another infection, but the antibiotic is not going to work. So you get into a cycle
Yes.
of hard to treat and recurring ear infections just by
Yes.
virtue of using the antibiotic in the first place.
Yeah, I've heard that so much is that, it's actually the use of the antibiotics that's causing the recurrence.
So
That,
many times I have parents come to me and say, the child never had an ear infection until last October.
yeah.
But October, the child had an ear infection, and now 4 months later,
Yeah.
we're still on all these different antibiotics because we can't clear it. And actually, the problem is the initial use of the antibiotic and the continuing use of the antibiotic as time goes on.
Yeah, yeah. It's really so interesting because even things like bronchitis, I know, it was always so traditionally treated with antibiotics, but what we found is that most bronchitis too is viral and can actually make it worse.
Well, as a pediatrician, for me, it's basically almost a joke that we as pediatricians, we don't treat bronchitis because we don't believe that it exists in children in terms of being a bacterial infection. So we never treat it. It's not even in our vocabulary.
Yes.
But invariably, when a family comes to me, either the mother or the father says to me, I went to my doctor and I have bronchitis and I'm on an antibiotic, and therefore I would like you to put my baby on an antibiotic. And I
Yes.
just know that this is something I'm going to have to deal with because
Yes.
it's just a part of this overuse, is part of this learned helplessness on the part of parents and children of wanting something, of needing something, of needing the doctor to be part of the cure all the time.
Yeah. Do you think that's leading to a lot of the overuse? Because I know that it is not the recommendation. The American Academy of Pediatrics doesn't recommend it, and this has been, a decade of recommending, decreasing the amount of antibiotic use, although we've not seen a decrease. So, what do you attribute this to?
That's a good question. You'd have to ask the 94% of pediatricians who still use antibiotics to treat ear infections when a landmark study that came out in 2004, which had such dramatic results showing that 80 to 90% of ear infections clear up on their own without treatment, and therefore the American Academy of Pediatrics and the American Academy of Family Physicians came out with a joint statement
Yes.
saying that ear infections should not be treated, that the parents should be given a wait and see attitude, and specifically that's what it's called in quotations, wait and see, where the doctor is supposed to tell the parents, we're going to wait and see 72 hours, just treat the child's pain,
Yes.
and most likely the child's going to get better without any antibiotic. You don't need a prescription, but doctors don't do it.
Yeah, yeah, they're ready to. Do you think it's just feeling pressure, not knowing, like feeling like they need to do something? Is that what it's coming from most of the time? I mean, I'm trying to get in the minds of like why this happens, or is it the pressure from the parents, like you said, of feeling like I paid for a visit, I'm here, do something, fix me.
Yeah, it's a combination of the doctor wanting to feel like the doctor's doing something,
Yeah.
and the parents wanting to feel that something is being done,
Yeah.
and also because doctors are really overworked these days,
Yeah.
and what they say, overworked and underpaid. Certainly, pediatricians are,
Yes.
and so pediatricians have to see more children in less time.
Yes.
It takes time. It takes time to explain, wait and see, 72 hours. This is what the American Academy of Pediatrics says because
Yes.
it's not really needing an antibiotic. It's just so much easier to say, here's a prescription. Then the parents walk out, everybody's happy. And the child is, in a sense, being exploited, but nobody really knows any better.
Well, it always takes more time to properly educate than to write a prescription. And
Exactly.
unfortunately, that we see that way too often in all areas of medicine these days. Is it's just a lot easier to just write your prescription, give you a procedure, do something rather than actually educate you or educate you on prevention or wellness or anything else. We don't do that, unfortunately. Well, some do,
Right,
but most don't.
and one, I think the very first sentence in my book, if I'm not mistaken, is something like doctors are trained to diagnose disease and use pharmaceutical drugs, and that is how they practice.
Yeah, yeah,
It would be very unusual to find a doctor who basically gives up on that and says, look, I know that antibiotics are useful in certain situations, but most of the time they're useless and even harmful, and therefore I'm not going to take the time to tell you why natural remedies are more important and more helpful and why you don't need an antibiotic. And the thing is that parents basically sometimes don't want to hear,
yeah,
because we're all kind of educated or miseducated to think that there is a quick fix.
yeah,
We tell children from the very early age they have to go to the doctor every time they have the most mild illness, the most minor complaint.
yeah,
They're taken to the doctor for some kind of a pill or some kind of prescription. And
yeah.
so it's really ingrained from childhood on.
Yeah. And I think that's such a good point because, obviously there are lots of really amazing pediatricians out there like you, Dr. Susan, like my pediatrician that I've been going to for years. I was just talking to you earlier and said, my daughters are 10 and 7 in their entire lives. Each one of them has had one dose of antibiotics in 10 years and 7 years. And in those times that they did have antibiotics, I knew it was necessary because when he finally said, this is the time you actually need it, we did it and it was necessary. I think that there is a place for it. I think the problem is that when you're going to a pediatrician where every visit that child is being given another antibiotic, you really need to question that and wonder, is there a problem here? Is there an overdiagnosis here, overprescription? And then why are you going to the pediatrician so frequently is the question.
Right, and the true issue is that our bodies have an amazing ability to heal themselves.
Yes.
And that every time we give any kind of drug, any kind of medication, whether it's fever-reducing medication or over-the-counter cough drops or
Yes.
Or antibiotics that we're talking about today, we are interfering with the body's natural healing.
Yes. Yes, absolutely. And we just keep breaking down that, like you said, it's so let's talk a little bit about antibiotic use and it's some of the negative side effects of using antibiotics beyond just the the obvious that it may not be working for what you're actually prescribing it for.
Well, I mentioned the word, it's a problem for society. There is so much amoxicillin. I bet it's in our drinking water because, children get. Where does the antibiotic go? And it doesn't disappear. It's in our environment.
Yes.
And there's so much antibiotic in our environment that we have created this all of these what we call superbugs.
Yeah.
It's such a big problem now that there are many bacteria that are resistant to antibiotics, and people are now in a situation where they're dying from having a tiny little abscess, just a little lesion, a little pimple on the arm.
Yep.
It could spread, and they could end up in the hospital and literally dying from something which is totally unnecessary. But it's just that we've created these bacteria that have, because of natural selection, have grown in our society and our environment that are not going to be killed by the antibiotics that we're using. And so it's kind of literally a germ warfare where we're trying to create stronger antibiotics, and the bacteria in turn are reproducing themselves in such a way that they're not being killed by these antibiotics.
Yeah, and what's so important for people to know too is that not only is the overuse of antibiotics affecting us in a general population-wide, way where we're creating these superbugs that will affect, the entire population, but we're really creating these resistant strains within our own body. So it's very personal too.
Absolutely.
Yeah.
And that was the whole thing about saying that these children, once they start on an antibiotic, they're on a merry-go-round
Yes.
more and different and stronger antibiotics that could go on for months.
Yes, absolutely. So it's really important. I think for a lot of our viewers, they're sitting with very young children. They're pregnant. They've got infants, and a lot of them are breastfeeding, and they're doing a lot of all the right things to increase their baby's health and prevent these kind of problems. And adding in anytime you keep adding in more and more stuff into their body, medications, antibiotics, whatever it is, you start to break down the body's natural defenses and can actually cause harm. So it's really important. I mean, I think that this topic became so important because we've got so many people who are writing in saying, my child's on the fourth course of antibiotics. It's not working. And not only is it not working, but like Dr. Susan said, it's actually creating issues later down the road where not only are you destroying all the natural good bacteria, the good flora in your body, in the child's body, but you're actually creating resistant strains that could make the child actually sicker if they were to get sick again.
That's right. And another thing is that the fact that a doctor says that the antibiotic is not working, what does it actually mean?
Mm-hmm.
If a child is playing in the exam room
Mm-hmm.
and is happy and is thriving,
Mm-hmm.
then what are we even treating?
Yeah.
There's nothing to treat. The child is not sick, but in fact, it happens all the time.
Yeah.
That the doctor will look and say something like, as I said, it's pink, there's fluid, I see some fluid, it's not going away.
Yeah.
But there's no reason to treat a child that's not sick, no matter what the eardrum looks like. The only reason to ever treat an ear infection under any circumstances is because the child is sick and in pain.
Yeah,
so,
that's such a good point.
And when that's the case, the best treatment, usually 80 to 90% of the time, is just to treat the pain, because the ear infection is going to clear up on its own anyway.
It's such a good point, because you may be coming in because the child has a cold or cough or runny nose, or and then they look in the ears, they say, oh, the ears look a little pink, obviously ear infection. And then, like you said, they're treating when there really are no symptoms.
And the ultimate is, and I mention this again in the book, the ultimate is when the child is in for a well child visit and isn't even in because the child is sick.
Yeah.
So many times I've heard the mother say to me, well, it was amazing. My child was in for a 12-month-old checkup, and I didn't even know. I didn't even think there was anything wrong. And the doctor said there's an ear infection, and the child's on amoxicillin. And
oh, my God.
It's so bizarre. It's so bizarre to be even treating a child that's in for a well child visit that's not even sick, but it happens all the time.
It's true. It's sad, but it's true. So, like, that just brings up another point. Like, what would somebody say? Like, okay, so you're a mom. You've got a child, you go in for a well checkup, or you go in for a runny nose or a fever or whatever it is, and they look in the ears and the child's not complaining of ear pain, and they want to put your child on antibiotic because they have an ear infection. What's a parent to do? Because I know they get really nervous, they get scared, they get intimidated. The physician will say, well, if you don't treat it, it's going to get worse, it can turn into something much, you become nervous.
I agree, and I think it's really hard to be a parent in that situation, just the same way I would be in that situation when I take the car to a mechanic. I mean, you just don't know, and that's why you have to educate yourself. That's why I wrote the book.
Yeah.
But the fact of the matter is that if the doctor does what the American Academy of Pediatrics recommends, which is to say, I believe your child has an ear infection, and we're not going to treat, you do not need a prescription. This is what you have to do. You have to treat the child's pain. You don't need a prescription pain reliever, though. Mm-hmm. You can do one of two things or both of these two things. You can give an over-the-counter pain medication like acetaminophen or ibuprofen.
Yep.
Most common brand names would be Tylenol and Advil or Motrin.
Yep.
And you can put drops in the ear, because you can put either pain-relieving drops, that is an anesthetic, and I think you do need a prescription for that. They actually numb the eardrum.
Yeah.
Or, which works probably just as well or almost as well, is just to heat up some oil. You just take, I'm talking about any kind of oil. It could be mineral oil, olive oil, garlic oil, baby oil. You just heat it up a little bit. Maybe you have a little bottle of it and you put it in some hot water, so that it's basically body temperature.
Yeah.
And you put that in the ear And that when those drops go onto the eardrum, it's very soothing, and that alone relieves the pain most of the time. Just leaving the child's ear facing up and putting a few drops in, that really helps. So
Yeah.
it's really topical treatment of the pain and or oral systemic treatment of the pain. That's really all you need.
Yeah. Yeah. No, that's such a good point. And that people have been asking a lot of questions about, eardrops, garlic oil, that type of thing, and basically it's the warmth that you're looking for, the warm oil.
Exactly.
Yeah.
Yes.
Okay. They're asking how much oil? Just a few drops?
Yeah, I mean, it doesn't matter in the sense that you can't overdose. If you put a lot in, it would come out because the eardrum is the ear canal is fairly small. So,
Yes.
but I would say 2 or 3 drops. Yeah.
Yeah, yeah. The one of the things that we had talked about was the whole concept of, you know, um, let's ask some questions, answer some questions, because I think it's going to bring up some of the points that we wanted to make here too. One of the
Yeah.
questions that came up was from, it's hard to read on here. I hope I'm getting the right person who asked the question. Forgive me if I got it wrong here. But I think it's Cindy from Florida. And Cindy asked, I haven't had a need to try it, but I heard that breast milk will cure an ear infection as well as many other topical issues. And I think in this case, she's asking about putting breast milk in the ear.
Yeah, I don't really see how that would be particularly helpful, although if it was warmed up, it might help just because of what I was saying about the heat. But
Right.
the thing is that when you're dealing with a middle ear infection, which is what we're talking about today, we're talking about otitis media,
Yes.
which is a middle ear infection. The barrier is the eardrum.
Yes.
So you can't really get across that eardrum barrier by putting breast milk into the ear canal. I know that we use breast milk in the eye for eye infections because you're getting right to the infection, but
Yes.
not so much in the ear. However, one of the things that I and the American Academy of Pediatrics agree on is that as far as those wait and see guidelines, the pediatrician is supposed to talk about risk factors, things to do in order to avoid ear infections, and one of the main things is to breastfeed the baby because not breastfeeding is a huge risk factor for ear infections.
Yes. Why is that? What is the reason that we see that?
Well, there's probably a multitude of reasons. One is that the breast milk has a lot of antibodies, a lot of immune system factors. So that's one thing. Another thing is that when babies are breastfed, they're usually held upright, and so the eustachian tube will drain, as opposed to sometimes when babies are bottle fed, the bottle is being propped and the baby is lying flat.
Yes.
A baby should never be fed lying flat because the fluid, the milk, just automatically goes backwards down the eustachian tube right into the middle ear.
Yes.
So, and also the whole mechanism of breastfeeding is so completely different than the mechanism of bottle feeding, which will tend to suck fluid into the middle ear, whereas breastfeeding, using the jaw muscles to masticate, it's completely different, and it just avoids ear infections.
So they're actually sucking different on the breast than on the bottle, and that sucking motion is actually clearing out that tube.
Exactly.
That makes a lot of sense, and it's also just flooding the area with like you said, the antibodies that would kill any localized bacteria from growing in the nasal passages or anywhere.
Yes.
Perfect. So breast milk is a great thing. Maybe not in the ears. I don't think it can hurt. Like she said, like Dr. Susan said, it's warm, right? It's a warm liquid.
Yes.
It's not going to hurt anything. But breast milk in the mouth is probably the best way to go.
Right.
Okay, fantastic. Another question which you started to talk about is prevention. One of the questions that came in was from Zoe in New York, and she said, what was the best way to avoid an ear infection? Her daughter's 18 months old, and she hasn't had one yet, but she'd like to keep it that way. One way that you just mentioned was breastfeeding. What else?
To avoid eustachian... This is a lot of words, which I'll explain.
Okay.
To avoid eustachian tube dysfunction.
Okay.
Because basically that eustachian tube, which is there to drain, for fluid to drain and get away from the middle ear, If that eustachian tube is not working correctly, then the fluid won't drain, and so we say it's dysfunctional. And the reason that it would be dysfunctional is mainly because it would be swollen. If the eustachian tube is inflamed in any way, if the wall of it is swollen, then it's blocked and it can't drain. So the things that cause eustachian tube dysfunction would be things like the child having a cold, where things get swollen, the mucous membranes get swollen, a child having allergies, irritation from tobacco smoke,
Yes.
and getting the bottle feeding and getting any milk in there, any cow's milk or soy milk, which would cause an inflammation, like a little bit of a reaction to something foreign.
Mm-hmm.
So any of those things you would want to, as much as possible, avoid. I mean, it's hard to avoid the child having a cold, but it is suggested that children should not be in large daycare centers where there's a lot of children around that are kind of coughing and spitting on each other.
Yeah. Just getting this image of them all spitting on each other, sneezing on each other,
Right.
wiping each other's noses. Yeah, I remember those days of daycare. The first year was not fun.
Right.
I think that they're asking in the chat room, and I think I want to make the clarification too about the fact that a lot of moms breastfeed lying down. And, is there an issue with lying down to breastfeed? I'm going to answer this. I think you would agree. We're talking about not laying flat on your back or laying backwards to eat, correct? Like if you were eating to the side.
No, I mean, I know that some. I think if the child is prone to ear infections, then you would probably want to avoid having the child being completely flat on his or her back while being breastfed. But even when a baby is being breastfed lying down, I don't kind of really see them being totally flat on the back.
They're not.
I see the mother, cradling the baby in her arm anyway, so that there is that little bit of verticalness anyway.
Yes.
And also it's not as bad because the breast milk has antibodies and a lot of immune factors in it, so that it's kind of curing itself, even if it does get into the middle ear, as opposed to artificial feeding, which doesn't have that property.
I think the point is that if you are bottle feeding your baby, even if you're bottle feeding your baby, then what you want to do is sit them more upright while you're feeding is the point, correct?
Yeah, I mean, in the natural in the usual natural breastfeeding position, a baby is being held, in the mother's arm and at an angle, and babies who are being bottle fed should also be held like that, but often they're not. Often they're just, in a car seat or just somehow not in a situation where they're where they're more upright. I guess in a car seat they're upright too. It just bothers me to see a baby on the floor in a car seat and the mother or the father with an extended arm just kind of holding the bottle there.
Right.
But that doesn't hold as far as being upright, because I guess the baby is upright and not usually flat. But there are definitely situations where a bottle-fed baby is completely flat, especially when they know how to hold the bottle by themselves. I see that all the time.
Yeah,
The baby's lying on the exam table or crib, and they're just holding the bottle up.
Yep. Yeah. You need to hold your babies, whether you're breastfeeding or you're bottle feeding. The point here is you need to hold your babies, cradle your babies, and sit them a little bit more upright to feed them. And especially if it's formula in the bottle, which is then going to increase your risk of an ear infection, especially then you want to keep the baby in a more upright position.
Agree.
Mm-hmm.
Well said.
Yeah. Now, what about food allergies? You started to touch on the cow's milk and some dairy. That's also, and we did a whole show on that. That was an interesting show. If anybody missed that episode on our cow's milk episode, it was great. And I got to tell you, I haven't had cow's milk in my house since that episode.
Well,
we do not drink it anymore at all.
There are so many quotes in the chapter on the chapter's called "Milk Not for Human Consumption." Of course, it refers to cow's milk.
Yes.
And there's so many quotes in the book about how, milk is the worst food. Cow's milk is the worst food for humans, and we should all stop drinking it today. And it really is. It's one of these things that, you're taking a protein, a pure protein from another species, and giving it to a human baby, and it's just such a setup for allergies. It's just unbelievable how
Yep.
the American Dairy Association has, created this aura for the American public that every child needs milk from the cow, but it's totally erroneous, and it really can be quite harmful, and it really is a major cause of food allergies.
Yeah, if you haven't seen that episode, I highly recommend going back through the archives. Watch the episode on human milk, not cow's milk, not for human consumption. It was a great episode, and then Dr. Susan has a whole chapter in her book. If you're not willing to give it up completely, at least you can start cutting back, and it may be not giving it to your child. So that's the first thing. They're asking about soy too. We're not gonna get off topic tonight, but go back to that episode. I think we covered a whole bunch of things in that episode.
Yeah, and I do have, and in that milk chapter, or actually, I think it might be in the chapter on breastfeeding. I talk about how soy. A lot of parents who are more involved with more natural things hold up soy as being the perfect alternative to breast milk. But there are so many problems with soy milk that it is really one of the absolute worst things you can feed a baby. And so, again, if you read that chapter, you won't be giving soy milk either. I guarantee it.
Yeah, we don't use any soy at all. It's not good for babies. It's not good for moms. It's not good for moms, especially if you're postpartum. Soy in general is just something to stay away from, in my opinion. So, yeah, okay.
Big business, I can tell you that. There are so many farms in all over the world have been converted into creating soybeans because it's so huge.
Yeah.
But the way that it's processed, there's so many toxins in it, and there's so many things about the soy hormonally that interfere. It has a tremendous estrogen effect.
Yep.
And we're seeing girls with early puberty. Oh, it's just a big mess. I would really stay away from soy.
Yep, and it's really bad for your thyroid too. So anyone who's postpartum, especially when you're at risk already for your thyroid function to be low, soy definitely is bad for your thyroid as well.
Yeah, and the thing is that I see someone wrote in the chat room, how should I drink my latte? Nothing is absolute. You can have a little bit of milk, you can have a little bit of soy, but it's not the be-all and the end-all. It's not that children have to have 4 glasses of milk and 3 slices of cheese every day.
Yes.
But if they want to have a little milk with their cereal and they don't have any problem with it, that's fine. And the same thing with soy in your latte. It's okay, but just don't overdo it, like not overdoing everything or anything.
Yep, we love coconut milk too. I see that in the chat room.
I think that's great.
Coconut milk is great. Coconut milk is great for your babies too, and it's actually the only other food that has the medium chain fatty acids in it, just like breast milk. And so it's a fantastic, healthy food for you, for your child. My child was actually showing, we're getting off topic, but my child was actually showing signs of dairy allergy that I didn't even know to be signs of dairy allergy, like dark circles under her eyes, things that you would never consider allergies. But these were, and it's so much better now that we've cut out the dairy. She still eats cheese, so like you said, it's not about, ending everything, but we've stopped drinking the milk, like glasses of milk, and they don't need it. But anyway, go back to that episode and watch that. This is another perfect example why the archives are so important. I mean, these topics, just because we did this, 8 months ago or a year ago, doesn't mean that it's not relevant to you today. You may have just had your baby, or you're dealing with issues that somebody else was dealing with a year ago. These topics are not outdated. Go back and watch them. You don't only have to join us for the live shows. In between, there's every other day of the week. You could be doing My Baby Experts every day of the week, right?
That's right, and that's why frankly, the book, I feel like the book is not going to be outdated. I mean, maybe 40 years from now, I'll have to revise it.
Right.
But most of the things that I say are timeless, and that's great because it took me 4 years to write it, and I don't want to spend another 4 years on it, but doing a revision. But I think for the most part, these things are just so true.
Yeah.
To have a healthy lifestyle, to eat natural foods, to eat whole foods from the earth that are not processed, to have your child go outdoors in the natural sunshine to get vitamin D.
Yep.
These things don't change from year to year. They're timeless.
Yes. Yeah, absolutely. We're going to do a whole show on vitamin D. Will you come back and do that with me?
Of course.
Yeah,
yes.
I really feel like, that's something we definitely want to cover. when we talk about different ways to help boost immunity, because I think that's one thing I don't want to miss tonight is talking about, like, how do we, is as far as prevention, we talked about some of the ways to prevent ear infections, but building your child's immunity, which you cover in the book, is one of the best ways to prevent it, because you're going to prevent those infections, those viral infections, illnesses from occurring in the first place. What are some
Yeah.
basic things that they can do to help boost a child's immunity?
Well, one thing is to breastfeed, and
Yep.
any pediatrician who is interested in anything that's real and true
Yeah.
is going to tell you that breastfeeding is a very, very important factor for increasing a child's immunity, because for so many reasons. For one thing, the baby is getting antibodies to everything that the mother has antibodies
Yes.
against, including any time the mother's ever been vaccinated against, let's say, chickenpox or whatever when she was a child, or whatever illness she's ever had. There are antibodies in the breast milk. So right
Yes.
away, a child who's being breastfed is not going to get sick just because of that. And also because it has its own very specific immune factors in the breast milk itself. So
Yes.
breastfeeding is very, very important, for 4 months, 6 months, 9 months, 12 months, a year, 2 years, three, however long a baby is fortunate enough to be breastfed. That's very important.
Yes.
As far as immunity, vitamin D that we were mentioning,
Yep.
the body's way to get vitamin D is not in a pill. It's not in a supplemental liquid. It's to be out in the sun. That's how
Yes.
we get vitamin D.
Yes.
Vitamin D is really a hormone, and the way it works is that we have the substance in our blood, and as the blood goes closer to the skin, and a pre-vitamin D, a precursor of vitamin D, is chemically converted into vitamin D. And you don't have to have a lot of sunshine, but you need the child to be out in the sun for a few, maybe 10 or 15 minutes, maybe 3 times a week,
Yeah.
without sunscreen.
Yeah.
And that vitamin D will be created, and it will be stored. Any excess vitamin D will be stored in the liver, so that in the winter months, when the child is getting less sun, the vitamin D can be reused, or can be used, and so that's very important for the immune system. Eating, fruits and vegetables, which you can't get from a pill.
Yep.
Even if you try to give the ingredients in broccoli or an apple or something like that, antioxidants and so forth, the way that it comes as a whole food is so much better than trying to just take parts of it and put it
Yes.
in some kind of juice or soup or anything like that.
Yeah. And avoiding sugars too is going to help as well.
Oh, absolutely. Yeah,
Yeah.
because sugars are not have no nutrition. It's just empty calories. I'm sure you want to avoid that.
Yeah. Yeah. Absolutely. Some of the other ways I want to just cover for a moment, that you can use, like, alternative treatments for treating ear infections or ear pain, because if your child is experiencing ear pain, it could be a lot of different things. It could be a viral infection. It could be that the child is teething. That could be causing it. It could be that, it's not even an ear problem. Like they said, the ear looks pink, but the child's not complaining of ear pain. But what if they were complaining of ear pain and you want to do this wait and see approach? Some very benign ways what you can do is, beyond just the ear drops like Dr. Susan recommended, there are homeopathic treatments, and that's really more in my area here, that I love using homeopathy for infants, for children during pregnancy, postpartum, all the time. It's something that Joe and I use almost regularly for all of our ailments. My sister was on several months ago, where we did a whole episode on homeopathy. I'm going to have her back on to talk about some of the, like, basic, most common ailments in children, to talk about which remedies would work for that. But I want to mention that certain remedies like pulsatilla, chamomilla, heparsol, these are some of the different remedies that you can use for ear pain, ear infection, and they work great. When my children have had ear pain, I've used these remedies and they went away. And that's one of the reasons why we didn't need many antibiotics. I never even needed to make it to the pediatrician's office, because we were home treating, And these lots of times homeopathy is confused with natural medicine, and it is a form of natural medicine, but it's not interchangeable with like putting oil in the ear. Um, there's so many different remedies that you can use. What I love is Highlands created, they have two products on the market. One is called their ear drops and ear tablets. And I think Taylor has a picture because I really wanted to show this to you. It's a blend of the homeopathic remedies that I just discussed. These are the ear drops, and then so that would go right into the ear. And then these are the earache tablets, okay, that you would actually, they're like dissolvable tablets that you put right in the baby's mouth. This would be a combination of about 6 different remedies. One's for fever, inflammation, restlessness, irritability, ear pain. And these have worked fantastic. It's the same company that makes the teething tablets. So you guys have, a lot of you have used teething tablets before. It works the same way, but it would just be for ear pain. So I just want to make sure that you all know that that product is available, and it's a great alternative. Did we cover everything tonight?
We'll never cover everything, but I think we did.
That was a loaded question. Let's see. Okay, so one more question here. Who's the question going to be from? Okay, this was a question that came in from Michaela in New Jersey. She said she was excited to hear Dr. Susan again. She's a 17-month-old that had a persistent cough. The doctors didn't see or hear any fluid in her lungs or ears. When the cough persisted for 10 days, they surmised that she had a sinus infection and put her on antibiotics, amoxicillin. They also recommended that they use Claritin each day because they thought she had underlying allergies causing a runny nose. What do you have to say to that about a sinus infection there?
I have to check, but I'm pretty sure that the sinuses are not developed until 18 months or more. So I don't think it's possible for an infant to have, or a toddler to have, a sinus infection.
Yeah.
And then using an allergy medicine, and I'm not sure whether those allergy medicines are approved under the age of 2. I have a feeling they're not.
Yeah.
I don't think that they've been studied, or therefore that the FDA has ever given approval for that.
Yeah.
But again, I mean, if allergy is an underlying problem, then we treat the problem. We don't
mask it up with
we try to eliminate the problem. So if the child has an allergy to a cat and there's a cat sleeping in the room, we wanted to change that situation. We don't want to give the child Claritin because there's a cat in the room. So again, it's really more of an issue where the parents need to be educated and not just given a prescription.
Yeah, no, absolutely. It's such a perfect example of overprescribing. I mean, and so many of these things, I mean, the first thing that comes to my mind is the kids teething too, like runny nose, mild fever, even a cough from like a runny nose with a post-nasal drip, all these things can be symptoms of teething. How about pulling at the ears? Because people ask about that too.
There's no correlation between pulling at the ears and ear infections. In other words, children who have ear infections do not often actually pull at their ears.
Yep.
And children often pull at their ears for various reasons. It's a habit, it itches, there's wax,
right,
but not because they're infected. So I totally discount that when the parent comes in specifically to tell me that the child is pulling at the ears.
Yep.
Usually that's not an ear infection.
Yeah. They just like to touch every part of their body.
Right.
They're pulling at it because it's there. That's all.
Right.
Oh, fantastic. Wow. What a download of information there. That was great. Really, really great. Did you guys enjoy that tonight? Yeah?
Yay.
Yay. What a fantastic night. Oh, my goodness. Dr. Susan, one more night of a ton of information. I think this really helped to clarify so much of the misconception and really empower our viewers to be able to first, ask the question, is this really necessary?
Exactly.
What's actually going on here? All we can do is keep giving you the information so that you can make the best choices. And it doesn't mean that it's going to be, always or, never. That's never what we're saying. But, getting educated, learning about it is always going to be better than not knowing. So it's just...
Right. And I think what I say, something in the book like, children who question their doctor, parents who question their children's doctor
Yeah.
are taking responsibility for their child's health.
Yep.
And that's very important to be doing that.
Dr. Susan, thank you for joining us tonight. I really appreciated having you here. Thank you again.
My pleasure.
It is time for the end of our show. I hope you guys all learned a ton tonight. It was another fantastic episode of My Baby Experts. I love you so much. Go kiss your babies, and I will see you. Mwah!